Imagine chewing like just a single piece of nicotine gum, and within 40 minutes, the blood flow to your most sensitive organs drops by this staggering 30%.
Right, and you didn't even smoke a cigarette.
Exactly. But your body is suddenly acting like a kinked garden hose, completely shutting down the microflumming that keeps your tissues alive and functioning.
Yeah, it is a really profound, immediate biological reaction. I mean, you introduce this one chemical, and you fundamentally alter the environment at a microscopic level. You're basically stripping away the tissue's ability to, respond and heal itself.
Well, welcome to the deep dive. We are jumping right into a fascinating, highly specific medical mystery today. We're looking at what happens when incredible 21st century regenerative medicine collides with our very common daily habits.
Yeah, this is a big one.
It really is. Our mission today is to explore how systemic nicotine and vaping actively sabotage the microvascular blood vessels in a really sensitive area, the vulval vestibule. And we'll unpack why this hidden damage basically ruins the effects of regenerative treatments like platelet-rich plasma or PRP.
Because we often think of medicine in a vacuum, right? Like, you get a treatment, the treatment works.
Right, A to B.
Exactly. But this deep dive highlights how the baseline environment of your tissue, the actual tiny blood vessels receiving that treatment, that dictates everything. If that foundation is compromised, the best therapeutics in the world just cannot do their job.
And we've got a really diverse stack of sources for you today to figure this out.
Oh.
We are pulling from a pretty dense biochemical study from Frontiers in Toxicology, some clinical notes from urology and gynecology experts, and this totally fascinating double-blind trial on women's physiological responses to nicotine.
It's a great mix of data.
It really is. Okay, let's unpack this. Because while it sounds incredibly technical, I mean, this is ultimately a story about how your blood vessels act as the ultimate gatekeepers to healing and sexual health.
Yeah, and to understand how those gatekeepers fail, we really first have to establish what they're doing when things are working correctly. So the vulval vestibule relies entirely on this intricate, flexible microvascular system. We are talking about a massive network of microscopic capillaries.
Like a sponge, almost.
Pretty much. And when we discuss sexual arousal or natural lubrication, it's really easy to frame those as purely physical or emotional reactions, But at the cellular level, they are strictly vascular events.
It's basically a fluid dynamics situation.
Exactly. The entire system hinges on a molecule called nitric oxide. When a woman experiences arousal, the endothelial cells, which are the specialized cells lining the interior wall of every single tiny blood vessel, they get a signal.
Okay, and then what happens?
They use an enzyme called endothelial nitric oxide synthase, or ENOS for short, to produce that nitric oxide. And that nitric oxide acts as a really rapid chemical messenger. It travels to the smooth muscles surrounding the blood vessels and basically tells them to relax.
So they loosen up.
Right. When those muscles relax, the vessels widen, blood rushes in, and that vasocongestion is the actual engine-driving sensation, tissue health, and lubrication.
So nitric oxide is the key unlocking the door for the blood to flow in. But the sources point out that nicotine fundamentally changes that baseline environment, right? Because it's a potent vasoconstrictor.
Yeah, nicotine actively interferes with that enzyme. It prevents the enzyme from activating properly. So your endothelial cells suddenly just can't produce enough nitric oxide.
Oh.
And without that specific messenger telling the blood vessels to relax, the default state is constriction. The smooth muscles clamp down, the vessels narrow, and you have severe endothelial dysfunction. The gatekeepers basically close the gates.
And to show you just how powerful and immediate this clamping down really is, we have to talk about this clinical trial from the sources. This was a randomized, double-blind, placebo-controlled crossover trial. They brought in 25 young, healthy women.
And the crucial detail here is that these women were all non-smokers. Yeah, the researchers needed to isolate the acute, immediate effect of the nicotine itself. If they used regular smokers, they'd be dealing with the confounding variables of long-term lung damage or chronic vascular stiffness.
Yeah, or like years of tar accumulation.
Exactly. They wanted to see what happens to pristine, healthy blood vessels the exact moment nicotine is introduced.
So they gave these women a piece of gum about 40 minutes before having them view an erotic film to stimulate arousal. And because it was a crossover trial, sometimes a participant got a placebo gum, and other times they got 6 milligrams of nicotine gum.
Which is a very small amount, by the way.
Yeah, it's roughly the equivalent of smoking just a fraction of a strong cigarette.
Right. And the researchers were tracking physiological sexual arousal using vaginal photoplethysmography. It's a highly sensitive tool that measures vaginal pulse amplitude.
Which means what exactly?
In plain terms, it measures the literal volume of blood pooling in the microvasculature of the vaginal tissues in real time.
And the results were genuinely shocking. That single isolated 6 milligram dose of nicotine caused a 30% attenuation in physiological sexual arousal.
Yeah, it's huge.
A 30% drop in localized blood flow just from chewing a piece of gum.
And I think the most fascinating element of that trial is the psychological disconnect it revealed. Because the women's subjective rating of their arousal, like how turned on they mentally felt, that didn't change at all.
Wait, really?
Yeah. Their brains were fully engaged and sending all the right signals. But because the nicotine had chemically paralyzed that eNOS pathway we talked about, their vascular system simply could not respond to those signals.
Wow, so the brain is hitting the gas pedal, but the engine is totally flooded.
Yeah.
Go back to my garden hose analogy earlier. If your microvascular system is this complex irrigation network keeping a beautiful garden alive, nicotine is essentially a chemical tourniquet.
That's a great way to put it.
It kinks the hose. The water, the oxygen-rich blood and the nutrients just can't get to the tissue, no matter how much the brain wants it to.
And a kinked hose completely redefines the environment. If the baseline state of the vulval vestibule is clamped shut, the tissue is basically constantly existing in a state of low-level starvation.
Let me make sure I'm wrapping my head around this, though. A lot of people know nicotine is a vasoconstrictor. So the logical workaround you might be thinking right now is, okay, nicotine is the bad guy. I'll just use a vape, but I'll make sure it's completely nicotine-free vape fluid.
Right, like no nicotine means no kinked hose, right?
Yeah, exactly. It's a very reasonable assumption to make.
It is. For years, the general public and even parts of the medical community thought that removing the nicotine made vaping relatively benign to the vascular system.
Well, here's where it gets really interesting. We have this incredibly dense, detailed study from Frontiers in Toxicology that looks specifically at nicotine-free e-cigarette condensate, they call it e-vape, and what it does to human endothelial cells.
Oh, this study is wild.
It really is. And reading through this, I actually have to push back a little on what we're establishing, because this study seems to completely contradict the idea that the vessels are being clamped shut and starved.
Really? What did you find contradictory?
Well, the Frontier study says that exposing these endothelial cells to nicotine-free vape fluid actually increased cell adhesion. It increased cell migration. And it triggered a massive release of pro-angiogenic factors, specifically things like VEGF.
Vascular endothelial growth factors.
Right. And angiogenesis is the creation of brand new blood vessels. So if the nicotine-free vape fluid is triggering the body to grow a whole new network of blood vessels, shouldn't that be a fantastic thing for tissue health and healing?
What's fascinating here is that this highlights the difference between functional biology and pathological biology. You're absolutely right that angiogenesis, growing new vessels, is a natural, necessary process for things like wound healing.
Okay, so I'm not totally off base.
Not at all. But context is everything here. What the Frontier study uncovered is that the angiogenesis triggered by vaping is not healthy, functional vessel growth.
But I always assumed vaping without nicotine was just like flavored water vapor.
No.
Are you saying the fluid itself is causing a problem?
Absolutely. The base liquids in almost all vapes, whether they have nicotine or not, are vegetable glycerin and propylene glycol. And they seem harmless in their liquid state.
Sure.
But when you heat those liquids up to aerosolize them, which is, the entire mechanism of a vape pen, that thermal breakdown converts them into highly toxic chemical compounds, you're suddenly inhaling things like formaldehyde and acrolein.
Formaldehyde. Literally the chemical used to embalm biological specimens. That is so dark.
It is, and when those specific chemicals hit the delicate endothelial cells lining your blood vessels, they act as severe pro-oxidant cell stressors. They basically throw the entire localized tissue into a state of cellular panic. Yeah, the Frontier study identified the specific molecular mechanism here. These toxins trigger a massive spike in ARF6-mediated oxidative stress.
Okay, let's pause on ARF6, because that sounds like a droid from Star Wars. What is that actually doing?
It does sound like a droid. ARF6 is a protein. In a healthy cell, think of ARF6 like a highly trained traffic cop. It stands at the cellular intersection, calmly directing which proteins go where, keeping the internal environment organized and stable.
Okay, I follow.
But when you flood the area with the oxidative stress of formaldehyde and acrolein, that traffic cop panics. It throws away the rule book and just starts waving all the emergency growth signals through at once.
It basically flips a panic switch.
Exactly. The tissue literally feels like it is suffocating from the toxic stress, so the panicked ARF6 protein triggers the overproduction of all those growth factors you mentioned. Angiopoietin-2, PIGF, endoglin, and VEGF.
So it's not building new roads because it's thoughtfully planning a nice new neighborhood. It's frantically throwing down asphalt because it's in a state of absolute emergency.
Yes. And because that growth is so rushed and, chemically induced by stress, the resulting structures are a total disaster. This mimics the exact type of dysfunctional, chaotic blood vessel growth we see in solid tumors.
Oh my God.
Yeah, or in diseases like neovascular macular degeneration in the eye.
So the vessels are defective.
Highly defective. The new microvessels that form are hyperpermeable. They are leaky. The endothelial barrier, like the tight wall of the blood vessel that's supposed to keep the blood flowing smoothly and protect the surrounding tissue, it actually breaks down.
Wow. So we have two completely different but equally devastating scenarios here.
Yeah.
Systemic nicotine starves the tissue by acting as a chemical tourniquet, clamping the hose shut.
Right.
But nicotine-free vaping bombards the tissue with formaldehyde, causing the traffic cop to panic and build these chaotic, leaky, weak blood vessels that don't actually work.
Yeah.
Either way, the microvascular foundation of the vulval vestibule is just ruined,
Yeah, it's either an arid desert or a flooded dysfunctional swamp.
which sets the stage for the collision with regenerative medicine.
Precisely. Now we have to look at what happens when a patient receives platelet-rich plasma therapy in this area.
Okay, let's talk about PRP. A patient walks into a clinic. Maybe they're struggling with chronic pain, severe dryness, or a specific vulvovaginal disorder, and they want PRP therapy to regenerate that tissue. How does a normal PRP treatment work?
It is a brilliant concept, honestly. We draw a small amount of your own blood, put it in a centrifuge, and spin it down. This isolates the platelets, which are essentially microscopic vaults packed with your body's natural healing proteins and growth factors.
Great, the good stuff.
Exactly. We take that highly concentrated plasma and inject it directly into the vulval vestibule. The goal is to stimulate repair, build healthy new collagen, and restore normal function using your body's own blueprint.
Wait, so if we take blood from someone who actively smokes or vapes, aren't those platelets already damaged before the needle even goes back into their body?
The clinical notes are stark on this point. The toxins circulating in your blood from smoking or vaping actively alter the membrane receptors on your platelets. You are literally damaging the medicine before it is even extracted from your arm.
The vaults are broken.
Exactly. When the doctor injects that PRP back into the tissue, those platelets are supposed to activate. They need to recognize the tissue, open up, and dump all those healing growth factors into the area.
But they can't.
No, because the receptors on the outside of the platelets have been blunted and deformed by the toxins. They fail to activate properly. You end up with a significantly lower concentration of the key proteins actually deploying into the tissue.
But even if those platelets were perfectly healthy, how are they supposed to get to the tissue in the first place? We just established that nicotine acts like a tourniquet. You're basically injecting this medicine into a blocked highway.
Yeah, the delivery system is completely compromised. Healthy tissue relies on flow-mediated vasodilation, meaning the vessels can widen and adapt to allow fluids to circulate.
Right, that flexibility.
But because systemic nicotine causes severe vasoconstriction, the PRP that does get injected can't properly circulate through the targeted microvasculature. Instead of distributing evenly through a healthy network of tiny vessels to heal the whole area, it just sits in a localized, stagnant pocket.
So the medicine can't reach the cells that actually need it.
Exactly. And even if a few healthy platelets manage to activate, and even if they somehow reach the target cells, the systemic nicotine actively inhibits the tissue remodeling process itself. Nicotine blocks the healthy function of VEGF, preventing the formation of strong, new capillaries.
It's fighting it every step of the way.
It really is. Furthermore, the sources note that collagen synthesis drops by up to 40% in smokers.
A 40% drop in collagen synthesis. I mean, that completely defeats the entire purpose of an anti-aging or regenerative treatment. The whole point of PRP is to build new collagen to make the tissue elastic and resilient again.
Yeah, it's incredibly counterproductive.
It's like hiring an elite construction crew, the PRP, to rebuild a house. But you've locked up their tools by blunting the platelet activation, you've blocked the roads to the site with vasoconstriction, and you've set the materials on fire with oxidative stress.
That is a perfect analogy. It is a perfect storm of biological interference. You are asking your body to perform a symphony of cellular repair, but the instruments are broken, the acoustics are terrible, and the conductor is missing. The regenerative process simply cannot take hold in that environment.
And so the blood vessels are ruined, the delivery highway is blocked, and the platelets themselves are blunted. But surely the tissue itself is still trying to fight back locally, right? Doesn't the body have local hormones like estrogen to try and maintain that tissue even under stress?
It does, and that brings us to the final, perhaps most insidious blow revealed in the source material. The health, thickness, and elasticity of the vulval vestibule are heavily dependent on local estrogen levels.
Right. Estrogen is what keeps everything plump, lubricated, and structurally sound down there.
But nicotine and other tobacco compounds pull off a very specific biochemical hijack in a completely different part of your body, your liver.
Wait, the liver?
Yeah. When these toxins enter your bloodstream, your liver goes to work trying to clear them out. To do this, it induces the production of specific cytochrome P450 enzymes.
Okay, and these are basically the liver's chemical processing plants.
Exactly. Nicotine specifically hyperactivates an enzyme called CYP1A2. Now, think of CYP1A2 as a heavy-duty broom. Its job is to aggressively sweep toxins out of your system.
Sounds like a good thing, though.
It is, but the problem is that this enzyme is a blunt instrument. When you flood the liver with tobacco compounds, you ramp up the production of this broom to deal with the emergency.
Uh-oh. And while it's sweeping out the toxins, it sweeps up something else.
You guessed it, it sweeps up your estrogen. The hyperactive CYP1A2 enzymes aggressively bind to circulating estradiol, which is the most potent form of estrogen in your body. It converts that estradiol into a much less active form and accelerates its clearance from your system entirely.
Wow. Let's put this all together for you listening. If you're seeking out PRP therapy for vulvovaginal health, you already need regenerative help. You're likely dealing with thinning tissue or discomfort, right?
Right.
But the nicotine isn't just restricting your blood flow and ruining your platelets. It is actively telling your liver to drain away the very hormones, the localized estrogen needed to keep that vaginal tissue healthy and receptive to the PRP in the first place. You are being chemically drained of your primary local defense mechanism.
It is a systemic drain that manifests locally. As the clinical notes from the gynecological experts point out, this accelerated clearance of estrogen leads directly to thinning vaginal tissue, increased dryness, and significant discomfort.
It creates an environment that is the exact opposite of what the PRP is trying to achieve.
Exactly.
So what does this all mean? We've gone incredibly deep into the cellular mechanics today. We've seen how systemic nicotine acts as a chemical tourniquet, stopping nitric oxide production and clamping down the vital microvasculature.
Yeah, that 30% drop.
Right. And we've uncovered the illusion of the nicotine-free vape, learning how heating vegetable glycerin creates formaldehyde that panics your cellular traffic cops and builds chaotic, leaky blood vessels.
And we tracked how those two damaged environments completely sabotage platelet-rich plasma therapy. By altering your platelet receptors before the blood is even drawn, blocking the delivery pathways, and crashing your collagen production by 40%.
And finally, we saw how your liver's emergency response to these toxins acts as a blunt instrument, literally sweeping away the localized estrogen your vulval tissues desperately need to survive.
The clinical takeaway for anyone considering regenerative medicine is absolute. If you want a localized therapy like PRP to actually work, you have to remove the systemic sabotage.
So quitting, basically.
Yes. The consensus is that you need to quit smoking or vaping at least 2 to 4 weeks beforehand. That specific window gives your endothelial cells time to recover their function, it allows the ARF6 oxidative stress to clear, and gives your newly formed platelets a chance to regain their full regenerative potential.
It's all about giving your body the permission and the proper environment it needs to heal itself. But as we wrap up today, I really want to pivot back to the sheer scale of what we've been discussing, because we focused intensely on one very small, specific area of the body today.
Right, and that raises an important question, something to really mull over long after this deep dive ends. Today, we mapped out the highly specific, incredibly disruptive damage that these invisible vape chemicals and nicotine compounds cause to the microregenerative processes in the vulval vestibule.
Yep.
But your endothelial cells, those vital gatekeepers of your blood flow, the ones relying on nitric oxide and ARF6, they're exactly the same everywhere in your anatomy.
They're universal.
Exactly. So if merely inhaling vape fluid can fundamentally reprogram the behavior of your endothelial cells,
Yep.
flip panic switches, blunt your natural growth factors, and hijack your liver enzymes to drain local hormones in that one specific area, How might these exact same invisible chemicals be silently altering the microscopic regenerative processes happening in your brain, your heart, or your lungs right now?
That is a haunting thought, honestly, but a really vital one. It's a reminder that nothing in the body happens in isolation. I mean, you can't poison the soil and expect the garden to thrive, no matter where that garden is. Thank you for joining us on this deep dive. Keep asking questions, keep looking past the surface, and keep exploring the amazing interconnected systems of your own body. We'll catch you on the next one.